Good morning. My name is Simone Parker, and I'm with CalPERS Stakeholder Relations Team. It's my privilege today to host this town hall with representative of CalPERS Board, Yvonne Walker. Before I do that, I'd like to explain the format of this meeting. It's simple. Yvonne will provide some updates on CalPERS. Following her remarks, she'll take a moment to answer questions that you may have, permitting time. If you have questions when it comes time, we ask that you raise your virtual hand so that we can call on you. You can access this feature by clicking the heart icon on the bottom of your toolbar in the screen, and then select the raise your hand option. Once we call on you, you can click the microphone to unmute. And if you need accommodations because you're unable to raise your hand, please reach out to our moderators to see if they can assist. If you need closed captioning, you can click on the CC button on the toolbar to enable that feature. As you were notified when you joined the webinar, it's being recorded and it will be posted on our YouTube page next week. If you want to be automatically notified that the video has been uploaded, you can subscribe to our CalPERS YouTube channel. We have an hour together, so let's make the best use of our time. So with that, I'm pleased to introduce Miss Yvonne Walker. She's serving her first term on the board, and she's served California and our nation for over 35 years, working as a union president, retirement security advocate, experienced pension fiduciary, state worker, and Marine Corps vet. She's known for being one of California's foremost leaders in fighting for pension and health benefits earned by our members and retirees. So with that, please help me in welcoming Ms. Walker.
Thank you, Simone, and it is good to be here together again. So I'm just going to jump right in, and the questions that have come at me the most over the past couple of weeks are, oh my goodness, with everything going on at the federal level, is our pension safe? Are we going to be okay? Is CalPERS going to be okay? So let me just start with saying, yes, CalPERS is going to be okay. I just want to remind you that, you know, we've always gone through ups and downs, maybe not as let me just stop there. So we've always gone through ups and downs, but CalPERS is a long-term investor, right? And so we have, just to make you feel comfortable, our pension fund is currently valued at more than $500 billion. It takes about $32 billion to pay our retiree pensions annually. So there's ample funds to continue paying our benefits. And again, the reminder, we are a long-term investor, right? So we don't have all our eggs in one basket. I will tell you though, one of the things that made me feel especially secure is, you know, shortly after, you know, all the chaos with the tariffs and everything else, I was reassured to know that our chief investment officer, our CEO, Marcy Frost, and all of our investment staff, like they have been on it, they have been monitoring, they have been going, so they're not just sitting back waiting to see what's happening. They are very much engaged and keeping an eye on everything. And so if there were anything to be concerned about, I would have known by now. And that's not to say that, you know, we won't see some downs, we probably will, but it won't be anything that will, you know, take CalPERS out. And also one of the primary questions were, can the president do anything to take away our pension? No, he cannot. You know, your CalPERS pension is a defined benefit that you have worked for, that you have earned. And I don't care who the president is, they can't take it away from you. The governor can't take it away from you. So that is the one constant in our lives. I think that is very good. The next thing, I had a question, I've got a lot of questions about the COLA because it's that time of year. We'll see the COLA on our May 1st paycheck. So most of the 98% of the people who receive a pension from CalPERS um, they'll get a 2% COLA, right? So it's broken up into like state retirees. Theirs is by law 2%. With some of the local agencies and schools and everything else, it's whatever's negotiated. I think schools are also at 2%. And then one of the biggest questions came about the paycheck protection adjustments, pension protect, anyway, the PPPA. And how does that apply? And the easiest explanation for me, and you can also go up and look at this on the website, right? But that was put into place for people who retired 20 to 30 years ago. And so that their dollars today are kind of equivalent to the dollars they had when they retired. They still have the same purchasing power or close to it that they had when they retired. And so that's anybody that retired from, let me get the date so I can tell you. It is 1965 to 1986, right? That kicked in for them for the state and schools, right? So theirs will be instead of the 2%, it'll be 2.95. And then for the contracting agencies, right? Again, it's 1965 to 1989, and it's again the 2.95. So that is that piece. I will still say that we are doing still going through adjustments on our healthcare transition because there's still, questions that are coming in. One in particular that came in that said, like, I can't go to, they have the PPO and they can't go directly to Blue Shield. They have to go through Included Health. So I asked about that. And my understanding is if you are in the PPO basic, right, you're not getting Medicare, then yes, you have to go through Included Health. But if you're in the PPO and you're getting Medicare, you go directly to Blue Shield. And I hope that helps. Our priorities on healthcare are still, we're focused on managing costs, improving the quality of care, ensuring access to care where members live, and ensuring that members get their specific needs met. And a constant refrain that comes in is, especially for folks who are out of state or who live in rural areas here in California and across the nation, right? And they only have access to the PPO. And it's a high premium, right? And looking at how can we get that lower, right? And so I will tell you, our healthcare team is consistently looking for ways to increase access for folks. We have not found a solution yet. And to be honest with you, it's hard. I mean, I worked on it for a long time at Local 1000 because we had a lot of people that were, rural and we represented folks in New York, Chicago, Texas, and Hawaii, right? And so it was the same kind of thing. And it's been particularly, it's a particularly hard nut to crack, but I will say that that people have not stopped working on it. And I was real pleased when I did get to CalPERS on the board and realized all of the hard work that's being done. And, we're just going to keep going, until we get successful, right? But we're not there yet. And for that, I do apologize. And then there was a question that came in about the CalPERS Medicare supplemental members covered by Blue Shield. And they wanted to know, can they receive telehealth services for medical and behavioral health care in their home after September 30th, 2025? through the services provided by Teledoc and Nurse Help 24/7 without a requirement for an in-person follow-up and with no change in the member's cost share. And so they can still do that. And we're going to continue to monitor any concerns or complaints regarding access to telehealth services available through your health plan, so that if you do have any, make sure that you're calling into our 800 number for CalPERS, right? And reporting what the problem is, so that our health care team can ensure that they're monitoring everything that's going on. So I try to go very quickly because I want to leave enough time. I want to make sure that we have enough time for your ongoing questions that you have. So I'm going to open it up.
Okay. Looks like we already have some hands raised.
Okay.
So the first on our list, and I apologize if I mispronounced your name, is it Araj? Go ahead and come off mute. Renee, do you want to try to take a member off mute to see if that helps?
Araj, are you there? I think it's Araj. IRAJ. Okay, you're on mute still.
Maybe we'll come back. We'll go to Joel and see if we can figure out the muting issue. Go ahead, Joel.
Thank you so much. Can you hear me?
Yes, Joel, how are you doing today?
I'm good. I want to first thank you, Yvonne, for doing this. It's really important that information be clearly provided concerning the impact of the economic uncertainty on our CalPERS benefits. My concern is that I don't think, based on everything I've read, even the Fed speech today, that we're going to be out of this situation soon. So I think the immediate future needs a different focus than maybe previous downturns in the economy and the stock market. And I was wondering if there are any opportunities for those of us who've been around for a while. I'm turning 77 tomorrow.
Oh, congratulations and happy birthday.
Thank you. I do believe, in terms of medical care, that CalPERS would be best off going forward in looking into what other countries do for not so much unified payer, but public medical care, like government run medical care. Lots of countries save money because they have facilities, especially for the basic needs of people. A lot of seniors have very basic needs that are predictable.
Mhm.
And those costs can be alleviated by having government-run senior centers and senior medical centers close to people, maybe a few physicians that are specialized training in geriatric medicine. I came up with this idea because my aunt was the founder of the first senior center in the country back in the Bronx in New York City. This is back in the 30s and 40s. And so she always said that that would be the best thing for seniors back then, would be local access to proper senior medical care. So that's, I want to put that idea in your head, and maybe you can see if there's any interest in doing that.
Absolutely. I will certainly pass that on to our healthcare team because I think that is a very good idea.
Thank you.
Thank you for your comments, Joel. Okay, so we'll go back to Araj. Let's see, are you able to come off mute and ask your question? All right, looks like we're still having trouble. So maybe we'll try to send you a direct message to try to assist you, and we'll just carry on with the list.
Okay.
So next up is Richard. Richard, go ahead.
Hi, can you hear me now?
Yes, sir.
Great. Thank you for taking the call, and thanks for having this webinar today. I'm a recent retiree after 31 years with Lassen County. I retired in December, and I wanted to talk to you a little bit today about kind of the culture and competence of the agency with regard to the way it treats recent retirees, because I was really surprised at how the process went, and I'm still in the middle of it. But in short, like I said, I worked for the county for 31 years. Kind of expected when I retired that my pension would be based on the formula that my employer and I had agreed upon, which is the classic 2% at 55 formula. But I learned after having very difficult communications with CalPERS because of the culture there of I don't know if you're aware of this, but the culture, and I guess the direction from you and the board, is to not identify employees when you call into CalPERS. Typically, they will refuse to identify who you're speaking with, and won't put anything in writing. I'm sure you're aware of that. You probably heard that complaint, but at any
I
rate,
did not, but I'm writing it down, Richard.
okay. But at any rate, my employer, and not through any real fault of their own, had failed to comply with this obscure regulation that requires an employer to have a publicly available pay schedule that's approved by CalPERS in order to process retirements. Now, CalPERS had, to my knowledge, never really enforced this regulation until I came along. People have retired from Lassen County, for the last umpteen years without having an approved publicly available payment schedule. And so anyway, they chose me, I think probably because of my high number of years and resulting high pension, to use me as leverage to get the employer to comply with that silly requirement. But I feel like I've essentially been discriminated against and just used as a pawn by the CalPERS staff to try to get the agency to comply, which they're doing now that they know they have this requirement. But in the meantime, they essentially reduced my pension that I and my employer paid into for the last 31 years. And of course, I'm appealing that decision. But in the meantime, I've just been, I guess, amazed at the lack of customer service and the lack of a concern for me as a 31-year CalPERS member in trying to get my entitled pension to me. I'm going to have to go through this appeal process. I'm in the process of hiring an attorney, et cetera, for what amounts to a meaningless technicality that has not been imposed upon any other Lassen County retiree, and probably no other county retirees across the state. I can't really find out because they're so secretive with the information. But you may have heard me mention this at one of your recent board meetings under public comment, which I only had 3 minutes to describe. But I'm really hoping that you might be able to change the culture there at CalPERS a little bit. There's really absolutely no accountability on the administrative side. And I understand how these bodies get, grow to the point of being bureaucratic monsters without any accountability. But you're there to hold them accountable. And I really, really hope that you do and encourage you to do so. So anyway, that's my only comment.
Well, thank you, Richard. And I appreciate your comment. I apologize for the experience that you are having. But I will say that it's, I have been really impressed with our CalPERS staff and the work they do. And I know it must feel like they're singling you out, but I know they don't do that. They are, they're tasked with following the law, whatever it is, right? And sometimes, the retirees don't know what that is. And so I get the frustration and everything else, but I just want to assure you that they're not trying to single you out or, provide bad customer service. I understand the frustration you feel, but that is not, I just want to put that out there. That is not the culture of CalPERS. I mean, what I have observed since I've been on the board is the culture at CalPERS is they're all about the retirees and trying to do the best they can for the retirees. Do they slip sometimes like everybody does? Absolutely. But then they try to correct it. But I will certainly take your concerns forward. And I'm sorry this has been your experience.
Well, and thank you for that. The facts are that they don't support your position, though. I've shown them, there's hundreds, if not thousands, of people in my exact same situation, which they have not reduced to the retirement pension, and they say the same thing that you do, that they're not discriminating, but the facts just don't support that. And I've asked them to demonstrate that, to no avail. So anyway, there you go.
All right. Well, again, apologize for your experience, Richard.
Okay, next on our list is Dana. Dana, go ahead and take yourself off mute and ask your question.
Hi, I am a retired school bus driver from Central California, and I was always just a part-time employee. The majority of my career was only 4 hours a day, so my pension isn't great big, but I do qualify to be in the classroom. I was able to work in 22 and 23 as a one-on-one behavioral aid, but after 2 years, I couldn't work anymore. That is the stupidest rule you guys ever came up with. And that's why I'm in this webinar, to let you guys know that hurts a lot of retirees who only worked part-time, and they could supplement their income with another part-time employment with the school district, with the experience that they've had their whole career. And I just don't understand it. I don't understand why that was made into a rule, or whatever it is you guys do. But I do thank you for all you do for us. But
Well,
sometimes you guys actually harm us without realizing it.
Okay, and that is never our intent. It is not a
Oh,
rule.
I'm sure.
It's a law, I will say, and as it relates to retired annuitants. And we get this a lot.
I bet.
But because the school districts were reporting their annuitants under the wrong code.
Yeah, that's not our fault.
It's not your fault, and it's not
Yeah.
CalPERS' fault, right? And so we have done extensive outreach to the various districts. And at not the last meeting, but the meeting before last, one of the representatives has said, look, we're one of the retiree representatives had said, look, we are, they are combating it too, right? We're working hand in hand and trying to get the school districts to get it under the right code and everything else, because it is not our intent to not have you be a retired annuitant. That is not anything that we're trying to do, but, just making sure. And I don't know what, some school districts get it right. And some, it's a little more of a struggle of working with them. But what school district were you at?
Well, I retired from Riverbank Unified School District in Riverbank, but as a retiree, I went to work in my hometown of Oakdale.
Oakdale, okay.
And yeah, and
All right.
they can't get enough behavioral aids. They can't. Nobody applies for the job because, as you well know, school districts aren't willing to pay them.
Right.
And most students or young people that come out of college that qualify for those jobs, they don't want to make just that amount per
Right.
hour. But a
Right.
retiree, it was fine with me. The
Right,
problem is it hurts the kids. The kids need us. And if we're willing to do it for whatever the step one pay is in a school district to help supplement our income, I feel like we should be allowed to do that because it's just part-time. You know,
Right.
I know you guys want somebody to get that job permanently so they'll pay into the system, but nobody's applying for that job.
right. And
There's
there are
several other
provisions,
ones.
there are provisions for that and everything else, but I took down the school district where you're at because maybe they need some further education.
Yeah, let's do that because
Okay, we'll give that a shot.
Yeah, I was really bummed when I had to when I opened that letter and said I couldn't work anymore.
Yeah, I would, yeah, I appreciate their use of your words. I'd probably be more than bummed, but okay.
Well, I knew it was coming. I just didn't know when.
Okay.
And sure enough, it came right about a month before school was out. So it just was unfortunate.
Yes. Okay, but I've taken down the school where you're working to see, if we can possibly get some further education and maybe hopefully get this resolved. I don't know.
They claimed the only way I could continue working is if I were to stop collecting my pension and then get a permanent job. Well, I'm not going to do that because that was a pain in the patoot to do to begin with. So I didn't want to do that, but I
Right,
do miss the students, and I know the students needed us.
right. Well, and I again, I will invite you to go to the CalPERS website too, because they do have a section on retired annuitants. They also have, FAQs and the video with the different rules and everything else. I don't know them off the top of my head, but I'd invite you to go look just to, familiarize yourself with it also.
Yeah, well, usually when I have a CalPERS question, I call my buddy that's on the board that you work with, but that's how I knew it was coming. It was inevitable. I just didn't know when.
Oh, okay. Well, I'm glad your buddy. I'm sorry you had to come to me now, but I'm glad your
No,
buddy.
I wanted to
I'm
know
teasing, I'm
truly
teasing.
what the sense behind it was, because it doesn't make sense.
Yeah. Now it was it's a law, right? And then
Whose
so
law?
what happens is with any agency, right? That when a law gets made, then they have to go through the office of the regulations and set the regulations for it. So, but CalPERS did not initiate the law. They just have to figure out how to implement it.
Yeah. Well, I would hope that you guys can come up with some kind of loophole where if you aren't working a full day and you're only doing a partial day, that they can make that work. Who knows?
Right. Yeah. To be honest with you, we're CalPERS doesn't come up with loopholes. We're not supposed to.
No, I'm sure
That would be bad.
nice.
It would be, but that's not what we do. So
Yeah.
but
Right, thank you.
I've taken down the school and I'll get somebody to reach out.
Yeah, it's Oakdale Unified School
Yeah.
District.
Yes, got that.
Thank you so much.
All right.
Thank you. Thank you. Mhm.
Leslie, you're next. You could take yourself off mute and ask your question.
Oh, hello.
Hey, Leslie.
Hi. Thank you for hosting this. So I have a question about, and it goes to helping first-time homeowners. And there was a program back in the 90s that helped me buy my first house. And essentially, a member could get a loan that is secured by the member's contributions, and the loan payments come directly out of your paycheck. And it paid, I believe it was up to 3% of your down payment. So I came up with 2% and I got a loan for 3%. And like I said, it helped me incredibly to buy my house, my first house when I did that. And I was just wondering if there's any thought of restarting this type of program, because the housing crisis in California, and the young folks, they're really struggling to buy a home. So that's my question. And I don't recall what the program was called.
Yeah, it was like a first-time home buyers program. I remember that
Yeah.
also. I don't know why it stopped. Nobody, we have not had any conversations about, starting that program. I don't know the reason why it stopped. I can ask
Mhm.
to see if there's any way, because you're right, it's a tough time. I know my daughter is living with me while she's saving for her down payment.
Right.
My grandson, and I'm loving it because I got my grandson all the time, but it's still tough for,
Yeah.
I don't know
Yeah.
how they expect young folks with student loans and everything else
Right.
to be able to afford
Right.
a house. And I think that this is the first generation that is doing worse than their parents, right?
Yeah. Yeah.
And that to me is incredibly sad when you
Yeah.
live in a nation, I think that is as great as ours, and with the resources we have, we should
Right.
be able to figure that out.
Right. And, I don't know why the program stopped either, but it seemed like a very low risk type of thing to the system, because it's, the loan is secured by the members' contributions and the payments come right out of your paycheck. So, just a thought I had is, it would probably be very helpful to people who were like me back in the early 90s.
Right.
So that's all I have.
I'll certainly ask, because I do remember the program. I don't know why it stopped, and if there's any roadblocks to even thinking about it in the future.
Okay. Thank you. I appreciate that.
Okay. All right. Thank you, Leslie.
Thanks, Leslie. Paul, you're up next. Go ahead and come off mute.
Hey, Paul.
Morning. Can you hear me?
Yes, sir.
Okay, I'm going to go back. You had a kind of a question on this already.
Okay.
Anyway, I'm down from the Southern California area. My wife and I are both retirees, but my wife has been working as a substitute to supplement her income since 2018. And just like the past call, in July of 2024, she got one of those letters. She works in 3 different school districts substituting. And I actually was on this call last year talking about the exact same thing when this happened, about the retired annuitants no longer being able to go in and work the 960 hours, which is in there. I have gone to the CalPERS website, just like you recommended to that other lady to do. I have spent hours. I have actually gone legally and looked into how these rules and things were written. And what I did come up with is the purpose of this law, or what was rewritten, is what I understand was to stop the double dipping, and which I know that's been an issue for a long time in other industries, where somebody goes and does a full retirement, turns around and goes back into another one and does within the same agency, right? So I fully understand how that works, but I don't think that somebody really paid attention, because it has, speaking to the school districts, I'll just give you the letter that came. It says, as per CalPERS government code sections 7522.56, 21224, 21227, and 21229, place statutory restrictions on the limited duration of work for retired annuitants. As part of these statutory limitations, districts are required to discontinue employment of retired annuitants for duration of work. As such, in an effort to not have any negative implications on your retirement, it is in the best interest of the district to comply with CalPERS and terminate the open-ended employment of retired annuitants and substitutes. What I got from the districts and talking in there, it has everything to do with how this thing was rewritten. But as that past lady that worked as a bus driver, it's not affecting 1 or 2 people. It is affecting a ton of people, even though when you go to your website and you look up about working in retirement, it says you can at 960 hours. What is on your website and what is going here is 2 completely different. It needs to be and I heard you say maybe the districts need to be educated. That could be true, but I heard that last year when I was on this same call that this was going to be taken care of, and apparently not, because that
It is an ongoing problem. I
Right.
agree.
the other district just now in the last month just sent another letter out. So now 2 out of her 3 districts has eliminated her, right?
Right.
So apparently they're not getting educated, or somebody has not looked into the attorneys that I spoke with basically said the rewritten how it was done is not descriptive enough, and they to allow somebody to read that and say, well, it doesn't include those that are working as a part-time, not in a full-time job or in a long-term. That's the big key, is if you call up and you're on the subline, you go in for 1 day and then you don't work for another week. That is quite different than somebody that's going in and going to take a 3-month term. And
Right.
that is what it was meant to cover. That because then you're covering for a full-time or a termed position, which is what this was meant to do, right?
So as I understand it, when you talk about how it changed, because that happened right when I first came on the board,
Yes.
and my understanding was all it did was clarify the rules that were in place and so clarified them and I ask this every time I get it on a call. I go back and I ask and I check it out, and the answer has always been they are doing it. The school districts had been using the wrong code, for their annuitants. And then when they were told, they just said, well, then we can't do it, but they were given the code. But I will ask again to have CalPERS, if possible, reissue the letter to the districts. Maybe there's additional education, and I will tell you, it's ongoing. It will probably be ongoing.
Well,
And part of the problem is, and to be honest, is, like if you've been doing something one way for a very long time, it is hard to adjust to, a lot of your processes are on automatic pilot. And so, anyway, but I will try to address it again.
well, one suggestion I might make is because I well know that school districts are one of the most inefficient places there is. I hate to say that to anybody, but we've been, both my wife and I, over 30 years in it. That letter would be better off coming to the person or participant, because I am a persistent enough person that I would go to that district and make sure that the person who's responsible for reading that would get it in their hands. Because I think we all know how emails get lost, letters don't get to the right people. So you could be doing
Well,
diligence. Yeah.
that is a suggestion. Let me see if we can make that happen. Right.
Yeah.
I don't know, so I don't want to commit to it. And I'd also invite you to connect up with the union, CSEA, because they are actively engaged in this and working on this also. But I will take that suggestion back. That's the first time I've heard that one. And it might be, I don't know if we can do it or not, but it might be even helpful just to have the letter up on the website there. And then so that if you had it, you could just take it, go on the website, take it off and say, no, you've got this code. It should be that code.
No, I would say that is probably even less expensive to do that and saving money, and that would be a good idea to do that. But I think if we take the responsibility, I mean, I'm passionate enough about this because it doesn't just affect myself and
Absolutely.
my wife. It's affecting a lot of people we know also. I
Yeah.
am that type of person where I will go and take that and pursue that and make sure the person that's supposed to see it would see it in front of their face.
Okay. All right. I will certainly take that forward, Paul.
Well, I would appreciate that.
Okay. Cool.
Ms.
Thank you very
Walker,
much. Thank you very much for your time.
Thanks, Paul.
I'll just let you know that we actually do post all the circular letters that we send to agencies. So if this was a circular letter that you're referencing that were sent to the schools,
It's
it
on the
would-
website.
Yes, ma'am. If they just search circular letter in the search bar on our website, it pulls up the page and you can see all that have been sent out.
All right.
Okay, can you guys double check that to make sure that that letter with the codes is on that website? And I'll be more than happy to go on there and look also.
Yeah, I'll look when we get off.
Yeah.
Okay,
Thank you.
appreciate that. Thank you very much.
My
Thanks,
pleasure.
Simone.
Mhm. Lindell, you're up next. Go ahead and come off mute and ask your question.
Hello, okay, can you hear me?
Yes, ma'am.
Okay, thank you. And thank you for doing this. I sent a question to stakeholder relations saying I'm a retired member and I have the Medicare supplement, the platinum supplement. And it was moved from Blue Cross to Blue Shield at the start of the year.
Yes.
And we received a letter from CalPERS saying that basically none of our member access to various healthcare providers would change. But that is not my experience with regard to my acupuncture appointment. When I belonged to Blue Cross, my acupuncturist billed it and Blue Cross but paid them, and I never had to do anything, and I'm 80 years old. And now that the move is to Blue Shield, the acupuncturist doesn't accept that, is out of network for both of them. Blue Shield says I can bill them for some kind of contribution. They have yet to send me the right form for CalPERS. So I've made a third phone call to try to get the right form. But from my perspective, I could have to pay at least $1,000 if they don't pay anything in acupuncture costs this year that I had to pay nothing under Blue Cross last year. So I'm wondering why the change from Blue Cross to Blue Shield, and if it's possible to return to Blue Cross as soon as possible, because Blue Shield is costing me a lot of money and paperwork and phone call hassles that are happening with Blue Shield, none of which happened under Blue Cross.
We won't, well, short answer, we won't be returning to Blue Cross, at least within the next 5 years. Last year, it was a 5-year contract. It went up for bid. We went through our RFP process, and the board selected Blue Shield as our PPO provider. And I will just tell you, anytime that you go through a change of that magnitude, there are always going to be blips and that we will work through as we're going on. I've taken down your name and your problem, and we'll try to see if I can get a better answer for you.
Thank you. How will I follow up with that?
You can send me an email.
How do I do that?
I'm Yvonne, YVONNE .Walker at calpers.ca.gov. Or if you have been sending it to stakeholder relations, you can continue to do that, and then it'll get forwarded.
Okay, thank you very much. I'll send a copy of what I sent to them. Thank you.
Okay, thank you. I appreciate that.
I appreciate your willingness to help, and I really appreciate your doing these webinars. Thank you so much.
Thank you.
You, Catherine, go ahead and come off mute and ask your question.
Hey, Catherine.
Catherine Kelly, did you still have a question?
You're on mute, Catherine.
All right, maybe we'll move to the next person and come back to Catherine. Oh, you're off. Go
There we
ahead.
go. I didn't have an unmute button, sorry.
That's
My
okay.
question is pretty quick, and you may or may not be able to answer this, but I'm wondering if you can elaborate and explain the process for managing IRMA letters as we submit those to CalPERS. I've submitted 2 years in a row. 1 year I got a response. This year I have not gotten a response. And I understand it takes about 60 days, but it's been about 120 days now. So I'm just wondering if there's any change in how those are managed, or if you can elaborate on how they're processed.
No, and I don't know how they're processed, and I don't know if there's been a change in management of the IRMA letters. So I don't know why the time has increased. But I will certainly, like I said, I can check into it to see. And when did you send it in, Catherine?
I sent it in January,
Okay,
right after I received it.
okay. All right, so yeah, I can check into that to find out.
Okay, thank you very much. I appreciate it.
Okay.
Thank you. Priya, if you want to click unmute, you should be able to ask your question.
Hi, Priya.
Oh, hi, can you hear me?
Yes, you're a little low, so talk a little louder for me, please.
Okay. I'm retired CalPERS, of course, and I have original Medicare with the PERS Platinum PPO, have had it for years. And my CalPERS premium was increased 30% this year, okay? And that's the correct figure here, 30%. That's a huge burden and hardship. I'm a single senior. And anyway, I decided to bite the bullet and stay with CalPERS, PERS Platinum, now Blue Shield, because it's the devil I know instead of the devil I don't know. I'm so afraid of insurance corporations denying me for some, quote, pre-existing condition or another. And who knows, if I went somewhere else, I could even get a premium that wouldn't be, close to what Blue Shield is now charging. But anyway, a couple of things I just want to say at the outset, and this is just sort of, I have watched over the years I've been, and this was started during President Obama, who I loved, of course, working on Obamacare. And things that were said over and over and over again, and continue to be said in certain areas. No more pre-existing conditions. You will not be charged or, more for pre-existing. So I believe that at face value. Well, the best information I can get, and correct me if I'm wrong, that is only true if you get your insurance through the Affordable Care Plan, the Obamacare. If you, like for us at CalPERS, if I had decided to look outside of my PERS Platinum for another insurance, they could absolutely pick anything out of my medical record and deny me for a quote unquote pre-existing condition. So pre-existing condition, all these years, and I consider myself a well-informed consumer, I assumed that we were safe wherever we went, even within the CalPERS system.
You
No, it
are
is
within the CalPERS system, yes. They will
the
not, the insurance companies cannot, that if you took a different plan than the PERS Platinum,
uh-huh.
you would not be denied, and it's in the CalPERS world, right? You do not pay. You will not get denied. I sorry, didn't mean to say pay, but you will not get denied for a prepaid, a pre-existing condition. Just like if you started working for the state, I will just as an example, and you had a condition, you would still be able to get your insurance, and they would not deny you because you're part of like the group plan.
Mm-hmm. Okay. And do you know, thank you for that. Do you know, can they really jack up your premium because of something they see in your chart?
There are times where, and I will tell you this last time, the premiums, especially for the PPOs, went up, like you said, 30% significantly, right?
Yeah.
And that is not the norm. And I will give again a shout out to our healthcare team because they work tirelessly to try to keep down costs as it relates to premiums. And so this year it was a combination of, residuals from the pandemic, prescription drug costs, and everything else. I don't think this next go round that we will see increases like that, but that one was, I will admit, last year was a shocker, and nobody was happy about it, but it was unavoidable.
Okay. If I could just continue, please.
Yes.
So I checked into, well, a couple of CalPERS alternatives, which were also not a whole lot different, either much worse coverage or close premium. So I looked outside, and guess where I looked? I looked at AARP. I love that organization. They're so great for seniors. And they, of course, sponsor United Healthcare. So I'm thinking, okay, I looked into that, and what you see in the contract is that AARP says right up front that they really aren't involved in, managing or overseeing United Healthcare or anything like that. United Healthcare is on their own, basically. Now, one of my concerns is I don't trust healthcare corporations. I mean, they're, the fox in the hen house. They're after maximum profits. I don't
Yes,
care
they
if
are.
it's a nonprofit, forget it. So I'm concerned. So when I looked at that thing with AARP, and I thought, if you can't count on AARP being in your corner with your insurance, with your Medicare supplement, boy, you're going to be on your own if I get out of CalPERS system. So my question is, and part of the reason I stayed with PERS Platinum at a 30% premium increase was for what I hope, but I'm asking you for verification or another answer. My hope that I have the umbrella of CalPERS over me that would help me stand up when needed for my needs, my coverage, my rights, instead of me being out here on my own negotiating with one of these, profit-seeking insurance companies. Would that be
Yes.
the case? That I do have some protection from CalPERS. Let's just say I had a problem with Blue Shield or whatever. Does CalPERS get involved at all as sort of a third party with particular interest, I guess, or duties?
Yeah, and so here's what happens. Okay.
Yeah.
Here's what happens. So CalPERS will. So when you get, if you're dealing with Blue Shield, right,
Yeah.
and you have a problem and they're not able to resolve, ask for it to be sent to a manager, and then call the call center, let them know about the problem, and our healthcare staff will then engage with Blue Shield.
Okay, so send it. So if I can't work something out with Blue Shield, I send it to a CalPERS manager.
No. So what happens is, when you call into Blue Shield,
Yeah.
and this is just in general, right? It's not specific, but in general, you call in, you're talking to whoever you get on the phone.
Yeah.
If you get no relief, from that person,
Yeah.
then say, hey, I'm not getting any relief. Can I speak to a manager? Can you, escalate this to a manager?
Oh, okay.
And then
And
I'm
then
asking
she'll-
you at the same time, and you escalate it to the manager, and the manager is still not able to help. Then I need you to call the call center for CalPERS, right? And our healthcare staff will then engage.
Okay, so I'm taking notes here. So if the manager, a Blue Shield manager is no help, then I call the CalPERS call center.
Yes.
And ask for who?
You can tell, you just call in whoever answers, you can tell them what the problem is and
Okay.
everything else, and they will escalate that to somebody on the healthcare team.
Okay, gotcha. Now, and I want to say this, I believe I'm 99% correct about this. I saw this coming with Medicare. When they first started having the oh, help me, I'm forgetting the thing,
The
where
Advantage
like a
plans,
spider. Huh?
the Advantage plans,
Advantage plans, thank you. Yes, and I had original Medicare, right? And I support Medicare, original Medicare. And I saw over the years more and more ridiculous things piled onto those Advantage plans, okay, for a way lower premium. And, like gym memberships. And, now it's meals delivered at home and on and on. And I thought, what's happening? Congress, it must be some Democrats in here too, giving away Medicare chip by chip.
privatizing Medicare chip by chip.
Yes, exactly.
Yes.
Privatizing, you bet, under our very noses. And nobody says
Absolutely.
that. I came to that on my own, just watching it happen. And nobody says that. AARP doesn't say that out loud because, of course, now they got their foot in the United Healthcare, and CalPERS doesn't say that. We need some advocacy on this. Everybody's going to be standing around scratching their head, and Medicare is just going to disappear.
Well,
It's
I
not
don't think
like-
Medicare is going to disappear. I don't think Medicare is going to disappear. And I will say,
no, it's going to be privatized.
and I don't think it'll be fully privatized either. But it is just personally concerning. But I will also say again, shout out to our outstanding healthcare team because they do, keep track and advocate and trying to make sure that we get the best things possible we can for our members.
Ms. Walker
So,
and Priya, I didn't want to interrupt you. I just wanted to let you know we got a minute left in the
I was just getting
hour.
ready to say that. Priya,
Wonderful.
it's been great, but I'm going to have to cut you off
Sure. No,
because
thank
I
you for
have
your
to wrap
time and
up
for doing this.
or they'll, turn off my microphone. But two things before we go. Up on the website, we have issued our 2023-24 transparency report. And if you're, wondering, it talks about the different programs, how things are going. I'd invite you to take a look at that. I found it very interesting. And one last reminder, if you do not have a power of attorney on file for something were to happen for you, I would encourage you to get one in place because once you're incapacitated, it is extremely hard for them to work through and get somebody to be your advocate. So if you don't have one, get one and get it on file with CalPERS. But this has been a great call. I will talk to you guys again in June. I think the date is the 20th. Look for the email when it comes out. And I want to thank all of you for consistently getting on. You don't realize how much energy you give me to be able to do this. I enjoy it as much as you do, and I get a lot of information and education from you also. So I feel like we have a symbiotic relationship. So thank you all, and I will talk to you in June.
Bye.
Bye.